Nearly 15,500 patients in Canada died over the span of 1 year while waiting for surgery or diagnostic scans, according to a new report based on partial government data. The policy brief, titled Died on a Waiting List by the think tank secondstreet.org, says 15,474 patients died waiting for health services in Canada between April 1st, 2023 and March 31st, 2024. The report said only 12 health bodies in 7 provinces provided full or partial data representing 62% of the country's population. The organization estimated the actual number of deaths could be closer to 28,000. Information obtained for the policy brief generally fell into 2 groups: cases where patients may have died waiting for life saving procedures such as cancer treatment, and cases involved patients dying while waiting for surgery or diagnostic scans that could improve quality of life, such as a hip replacement. Thousands of Canadians across the country find themselves on wait lists, in some cases for several years, with too many tragically dying before ever getting treated or even diagnosed. Harrison Fleming, legislative and policy director at secondstreet.org, said in a January 15th statement, Canadians pay really high taxes, and yet our healthcare system is failing when compared to better performing universal systems in Europe. The 15,474 figure does not include data from Quebec, Alberta, Newfoundland, and Labrador, and most of Manitoba, the organization said. Additionally, Saskatchewan and Nova Scotia only provided data on patients who died while waiting for surgeries, not diagnostic scans. Secondstreet.org has been tracking this data since 2018, and it has now identified a total of 74,677 cases where someone has died. That's in 7 years, 6 years, while waiting for health care in Canada. It's a small city. The report says that the government healthcare funding is not the issue, citing the provincial government's increased spending on healthcare over the last 30 years, and instead says changes to the system are needed. Total health expenditures represented an estimated 12.4% of Canada's gross domestic product last year, which is a record high outside of the 2020 and 2021 pandemic period. So,
what are the recommendations there?
Recommendations. The policy brief makes 5 recommendations to improve healthcare across Canada. The first is to have provincial governments improve their data tracking and disclosure. Another is to reform the way hospitals are funded, changing from block funding or annual checks to cover global budgets to an activity-based funding model where hospitals are paid based on their output in terms of services provided to patients.
What a concept.
Offering more healthcare choices is another recommendation. Patients who can pay for private care should be permitted, the policy brief says, saying this would align with better performing healthcare systems. Allowing patients to pay for treatment at local private clinics could take the pressure off the public system